First of all, I would like to ask for your permission to use this video for educational purpose and on internet.
Yes.
Tell me about, you had an open old-fashioned surgery. What year was it?
2009.
What were your symptoms before that surgery?
I was having pain down my legs, in my lower back, and I was getting to the point where it was hard for me to walk.
And that was going on for how long?
About 3 or 4 years.
Okay, and then finally they diagnosed you with a degenerative disc disease and some problem of the disc in the lower lumbar spine, and they did a surgery. I'm going to turn here. This is where we see that they did a L4 to S1 fusion, and it seems from the shape of the cage here that they came from the front. And then in the back, it seems that they put facet screws, so you got a anterior and posterior L4/5/S1 fusion. Do you remember that surgery?
I do.
Tell me a little about it.
I got there at about 5:30, 6 o'clock in the morning, and then they started the surgery. I was in surgery and recovery for about 12 hours.
Wow.
And then the recovery was probably about 3 months or so.
Now, how long did you stay in the hospital?
I was in the hospital for a week.
And then how long did it take you before you could freely ambulate?
About a month and a half to 2 months.
Before you can freely ambulate?
Yep. I was
Wow.
using a walker, really pretty much laying in bed because it hurt to move.
Yeah. How long did it take you to go back to your basic usual life?
6 months minimum.
6 months, yeah. Now, unfortunately, this is what you describe is what the open surgery look like. When we do when we do a same surgery these days, this surgery for us is not a 12-hour surgery; it's a 1-hour surgery, and vast majority of our patients walk within 2-3 hours after the surgery, and it's pretty much rare, especially in your age group, that patients stay more than one night in the hospital. This is pretty rare, actually. And the vast majority of our patients actually after 2 to 4 weeks basically are back to the basic previous life and work. Obviously depending on the kind of work they do. If you're a roofer or construction worker, it takes longer. But if you do a desk job, many of our patients go back to within 2 weeks to basic previous life. But your experience from the open surgery is pretty unfortunately usual for open surgery. It's nothing, it's not unusual what you're describing, but that's just a different technique. And I understand they opened you up from the front and back, is that correct?
Correct.
Okay, now how bad was the pain after the surgery?
It was really painful.
Okay.
My stomach incision actually didn't stop hurting for probably about 4 months.
Okay. Now, interesting is that we achieve exactly here like what you got. We deliver the cage from the front or side, but we don't go through the belly at all. We don't open the belly. We go open the side about with the OLLIF technique about 1 inch, or sometimes actually less, half an inch, and we put a tube system that actually gently dilate the muscle, and then we deliver the cage. So practically we achieve the same goal like the surgery you got, with a different that with our technique. It is generally about 1 hour to 1 hour and 15-minute procedure, and vast majority of the people go home same day or next day. So, and your surgery wasn't that long ago. It was 2012, correct?
2009.
Okay, 2009, yep. About 10 years ago. But your surgery that you got is still being done today.
Yep.
That kind of surgery is still a common procedure today. Okay, after knowing what the differences are, how do you feel about the open surgery?
I don't think I would do it again.
Yeah. Well, thank you for your interview.